Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is a cervical biopsy? A cervical biopsy is a minor surgical procedure in which a sample of tissue is taken from the cervix, the cylinder-shaped structure connecting the vagina and the uterus. A cervical biopsy may be needed if you had an abnormal pap smear, if your healthcare provider noted an abnormality during a routine pelvic exam, or if you are at higher risk of cervical cancer. /r/n/r/n This article will review the use of cervical biopsy, why it's needed, how it is performed, and what happens with the results. /r/n/r/n A cervical biopsy is important for the detection of canceror precancerous cells. Indications for a cervical biopsy include /r/n/r/n. In addition, a cervical biopsy sometimes is done to diagnose genital warts or cervical polyps. A healthcare provider also may choose to do a cervical biopsy on a woman whose mother took diethylstilbestrol, DES, while pregnant. /r/n/r/ns was prescribed from 1938 until 1971 to prevent miscarriage, premature labor, and related complications. The drug was discontinued in the US in 1971 when researchers discovered it increased the risk of reproductive cancers in the daughters of women who took it during pregnancy. /r/n/r/n Once a cervical biopsy has been ordered, it is important to know which type you will have. There are a few different types of biopsies, including /r/n/r/n. A cervical biopsy is usually safe for most women. Serious complications include /r/n/r/n. A cone biopsy, in particular, can result in heavy bleeding and, though rare, infection, injury to tissue, vaginal tears, perforation of the uterus requiring surgical repair, or impaired menstrual flow, cervical stenosis due to scarring. /r/n/r/n Some cervical biopsy procedures may be associated with an increased risk of premature birth due to an incompetent cervix. This is primarily a concern when more than 1 centimeter, roughly ½ inch, of tissue is cut out and is more common if a woman gives birth within 1 year of the procedure. /r/n/r/n If you have a procedure that may raise your risk of preterm labor, your healthcare provider will monitor you closely during pregnancy. In some cases, your healthcare provider may recommend a cervical circlage where the cervix is sewn closed. This procedure can help prevent preterm labor. /r/n/r/n Women who have acute pelvic inflammatory disease or inflammation of the cervix will usually need to wait until their condition has subsided before having a cervical biopsy. /r/n/r/n A cervical biopsy is generally safe during early pregnancy, although bleeding may occur. The benefits versus risks need to be carefully weighed for each person by reviewing pap smear results, any history of abnormal pap smears, and history of HPV infections. /r/n/r/n Tell your healthcare provider if you're allergic or sensitive to any medications or to latex. It's also important to tell your healthcare provider what medications you're taking, as some can increase the risk of bleeding. These medications include /r/n/r/n Your healthcare provider will tell you if you should stop taking these medications before your cervical biopsy and how soon. /r/n/r/n Don't use tampons, vaginal creams or medicines, or douche for 24 hours before the procedure, and refrain from sexual intercourse for 24 hours before a cervical biopsy. /r/n/r/n The place a cervical biopsy is performed may vary, depending on your condition and your healthcare provider's practices. Usually, it is done in the healthcare provider's exam room or in an outpatient facility. In rare instances, a biopsy may be scheduled in an operating room if surgery is anticipated due to any further complications. /r/n/r/n You will need to remove your clothing from the waist down and put on a hospital gown for your biopsy, so choose a skirt or pants with a comfortable top rather than a dress or other one-piece garment. /r/n/r/n exam rooms can be chilly, so it's advisable to wear or bring socks to keep your feet warm during the procedure. /r/n/r/n you do not have to make any special changes regarding food or drink before a cervical biopsy. However, if you will be having a cone biopsy, in which general anesthesia is necessary, you likely will be instructed to not eat or drink for at least 8 hours before your procedure. /r/n/r/n Most health insurance plans cover the cost of a cervical biopsy. Confirm that this is the case with your insurance company, and find out if you will need to bring a copay with you to your appointment. /r/n/r/n You may experience light bleeding after the procedure. The healthcare provider's office or clinic will likely have sanitary napkins, but you may want to bring your own just in case. /r/n/r/n When you arrive for your cervical biopsy, you will check in at the front desk. If you're having a cone biopsy, your healthcare provider may come out to greet you. /r/n/r/n In the waiting room, you will be asked to fill out paperwork consenting to the biopsy and agreeing to pay, if you haven't done so already. When it's time for your procedure, a nurse will have you empty your bladder and then escort you to the room where it will take place. They will give you a gown and leave the room to give you privacy after instructing you to undress from the waist down. They may check your blood pressure, pulse, and temperature before or after you change. /r/n/r/n Your healthcare provider may prescribe a pain reliever 30 minutes before the procedure. /r/n/r/n Here are the steps you will most likely go through for a cervical biopsy. /r/n/r/n Bleeding from the biopsy site may be treated with medication, and if necessary, they may also use a probe, electrocauterization, or stitches to stop the bleeding. /r/n/r/n After the speculum is removed, the healthcare provider or a nurse will provide you with towels to wipe any discharge or blood, and you may need to use the toilet. You may also need a sanitary napkin if you have discharge or bleeding. /r/n/r/n Recovery will depend on the type of biopsy done and if you had anesthesia. /r/n/r/n You will be taken to the recovery room and monitored with general anesthesia until you're fully awake and no longer groggy. Once your blood pressure, pulse, and breathing are stable, you will be taken to a hospital room or discharged. If you had the procedure done at an outpatient facility, you should arrange for someone to pick you up. /r/n/r/n After a simple biopsy, you may rest for a few minutes before going home. /r/n/r/n It's normal to have mild pain, cramping, spotting, and dark or black color discharge for several days after a cervical biopsy. The dark discharge is from the medicine applied to your cervix to control bleeding. /r/n/r/n If necessary, take a pain reliever for cramping, as recommended by your healthcare provider. /r/n/r/n Most healthcare providers recommend avoiding sex or using tampons for up to 2 weeks after a cervical biopsy. Certain activities may also be restricted. Full recovery from a cone biopsy may take several weeks. /r/n/r/n You may experience some pain after the cervical biopsy. Be sure to have pain relievers such as ibuprofen, naproxen, or acetaminophen available to help manage the pain. Call your healthcare provider if you experience any of the following signs of infection. /r/n/r/n Your healthcare provider will send your cervical sample to a pathology lab immediately after the procedure, and it can take a few weeks to get results. The pathologist will send a report describing whether the cells are normal or abnormal and detailing their appearance. The healthcare provider will then call you to share the results. /r/n/r/n If they're normal, it most likely means you do not have cervical cancer. Abnormal results can indicate low-grade dysplasia, mild, high-grade dysplasia, moderate to severe, or cervical cancer. Cervical dysplasia means there are precancerous changes to the cervix. /r/n/r/n Adenocarcinoma in situ, AIS, means that cancer cells are present but may still be localized to the area where they originated, pre-invasive. Though the cells appear cancerous, they do not yet have the potential to spread. /r/n/r/n The terminology in treatment approaches for cervical dysplasia can be very confusing. Make sure to talk to your healthcare provider about any questions you may have. /r/n/r/n Untreated cervical dysplasia may lead to cervical cancer in some cases. However, having cervical dysplasia does not mean you have cancer or will develop the disease. /r/n/r/n It can take years for cervical cancer to develop. Depending on how extensive or advanced the dysplasia is, your healthcare provider may decide that you need surgical resection of the dysplasia before it develops into cancer. Treatment options may include cryotherapy, laser therapy, loop electrosurgical procedure, LEP, or conization. /r/n/r/n Recommendations for follow-up and treatment will depend not only on your biopsy results but on your history of pap smears, HPV testing, age, and past biopsies. /r/n/r/n For example, suppose you have a biopsy that suggests chin2 and a history of a high-grade intraepithelial lesion, HSIL, in the past. In that case, recommendations may differ for someone who has a chin2 biopsy with no history of pap smear abnormalities. /r/n/r/n Remember, there are many factors that healthcare providers consider when recommending treatment. Two biopsies that look the same under the microscope may be treated very differently depending on age, history of pap smears, pregnancy, and more. /r/n/r/n Your healthcare provider may recommend a cervical biopsy if your pap smear results are abnormal. A biopsy can be done in a few different ways to remove abnormal cells and have them tested for cancer. /r/n/r/n This procedure is often done in a healthcare provider's office, with results available in a few weeks after the pathologist reviews the sample. /r/n/r/n The results will help your healthcare provider determine the best treatment options if needed. /r/n/r/n Having a biopsy and waiting for the results can be very anxiety-producing. But the procedure may be the best way to stave off cancer or illness before it becomes a severe and full-blown disease. That's why it's important to get regular screenings and, if necessary, a biopsy. When cervical cancer is caught in its earliest stage, there is a 93% 5-year survival rate. /r/n/r/n There are other causes of abnormal cells, including colon/r/n/r/n The exact length of time to abstain from intercourse will vary based on the type of biopsy and will be told to you by your healthcare provider. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.